Arterial bleeds are very easy to identify, especially in the venal spaces and axillary spaces. You'll notice pooling blood, and their clothes are absolutely soaked. That is a clear, easy sign of an arterial bleed. So now, we just finished the front half of respirations. Let's say I put a chest seal right here. I have not dropped the needle D yet. His tourniquet's on this side, so which way do I roll him?
Away from you.
Away from the tourniquet. Arm closest to you up. Other arm in. Now we roll our patient, and the tiger claws are down on the front. And now we're feet on the back, checking for any exit wounds, anything like that. I'm gonna move on to the H portion of my assessment. I'm gonna check out his head. I'm gonna look at his eyes, look at his nose, look at his ears. We're looking for any bruising, any bleeding, any cuts, any fractures. With his eyes, I'm looking to see if they're able to react to the light. I'm gonna put some sort of light inside of his eyeballs. One at a time, making sure they both do their job. He's not bleeding. All right, he's passed out. No blood. You're checking, you're checking, you're checking, you're checking. Every time you do a sweep, every time you're doing a sweep, you're checking. Cool, check. No blood. Check. Cool, check. Cool, check. Cool. No blood. All right, you're good. Nope, front. Who's the front number? Underneath the flag. Remember, X's.
So his airway's good.
Your best friend.
His respiratory is not good. What do you do?
It's right here.
Obviously, you take that off. Notionally, you took it
Yep,
off,
just
right?
like that.
All right. So one.
All right, you found blood again.
Going down.
All right.
One's going down. Both of them. One's going up. What do you do now?
There's still blood.
Still blood.
Needle D. Cool.
And then that's what we're
Okay. Now, fire suppressed.
Yep.
You are now officially in TFC, which is Tactical Field Care. What do you start your assessment with? You just did massive
Yeah, you're
memory.
listening for the hiss. Cool. The
massive
hiss is
memory.
going. All right.
So, you just do the jaw. Put his hands underneath. I'm not going to try to hurt you, but you have to force his jaw upwards and outwards. That's going to open his mouth. I'm just going to have you place your hands in the right position, and he will open his mouth for you.
Boom.
Okay, see blood.
See blood, so we want to...
What are you doing?
Well,
There's blood.
either turn his head sideways or turn his body sideways.
Which one do you think would work better?
Turning his body sideways, so he also has a
Let's move his body sideways. What are you going, while your patient is rolled, what can you do?
apply the...
You can look at his back. So, tiger paw from the trap.
Trap.
X, and keep going over until I tell you there's a wound. Stop. Yep, right there.
Wound.
Yep, so now what do you do? Your patient, reassess. Tourniquet. It's not bleeding. You're good. Not bleeding. Now you go back to rework. Grab the open mouth, hands on his chest, put your cheek next to his mouth. Alright. He has weak and labored breathing.
Weak and labored breathing.
Okay, so what does that mean? What does that tell you? He's struggling with what? So you have to watch. Put something down. Okay, reassess the right. We always think about the other side. Yeah. You now have the rising ball in the chest. Okay, now we are down with respiration. What's next?
You hear me spin my hand?
So he's responsive to verbal stimuli. Right. So on the AVE scale, that would be a V. Verbally responsive. They're going to test and tiger paw that side. Keep doing blood sweeps. You didn't finish. You find nothing.
Find nothing.
You're missing something. Make sure you go all the way.
Put a boot. Wow.
Hey Dan, I'm checking.
Pull the needle out. Do I hear that?
No, you do not.
I do not.
So what do you got to do if there's no hissing to it? If there's no hissing or relieving of the tension pneumothorax, you do another needle D.
Just farther. I'd go to the fifth one down.
Yep.
Circulatory.
Yep, circulation. So you're checking.
He's out. All right. Credit cards like this.
Pulses are good.
Pulses are good. And now, check his head.
Yep. Come over here. Your job is now, if somebody's going to move in, they need to grab their head and make sure it doesn't move that much. Yep. Easiest way. Arms alongside of his head. Grab his shoulders. All right. Cool. Like this. Crab grip. Now, That's the easiest way to him not move his head when you move him. Right?
Okay.
Everything's on there, right there.
He has a tourniquet on.
He's all missed. Mechanism injury. What was his mechanism injury? What happened?
An IED.
Toe pop.
Toe pop.
Injury sustained. What happened?
Left leg.
Okay.
Took a catastrophic hit. I don't know if it's amputated or not. I'll tell you that.
The lower